In today's video, we're going to talk about hoarding disorder. And the purpose of this video is not to diagnose someone, our friend, who may live with hoarding disorder, but to understand this better so that we can show empathy and compassion, and most of all, a non-judgmental attitude towards them. So hoarding disorder is diagnosed based on a specific criteria by Diagnostic Statistic Manual. That's or DSM. That's what mental health professionals use to diagnose someone with mental health illness. So number one criteria to diagnose is there is persistent difficulty and struggle with parting or discarding with possessions regardless of their values. So they differ with collectors who intentionally collect stamps, for example, photographs in an organized and well thought out manner. So those people who are living with hoarding disorder may tend to collect random stuff beyond their values. So the difficulty with discarding this possession is based on the perceived need to save this item. So they always think of, I may need this item someday or right now. And also there is anxiety related to discarding this possession. So there's always a struggle of discarding them because of that anxiety attached to it. So the struggle is really real here. So now this would result to excessive accumulation of stuff that will congest an area and compromise its intended use. Like for example, the living room is supposed to be used for relaxation and spending time with family. But because of this mental health illness, this individual will congest and clutter all kind of stuff in the living room to the extent that they no longer enjoy the space. And the only time that the living area is uncluttered or organized is when a family member, a cleaner, or someone in authority intervene and clean up the space. Because a person living with hoarding disorder do not have the capacity or the ability to get rid of his or her possessions. So next criteria is that there should be impairment of social, occupational, and other area of functioning of that individual, including maintaining a safe environment or place for oneself and for others, to the extent that there will be tripping hazard or fire hazard for this individual's house. So last is hoarding should not be attributable with other medical conditions like brain injury, cerebrovascular disease, and others. So the person should be free from any other medical conditions for us to say that this is indeed a mental health disorder. So the overall prevalence with hoarding disorder is around 2.6%, with higher rates among 60 years old and above. So it can get worsened with age. And according to National Alliance on Mental Health Illness, 1 in every 50 people may live with hoarding disorder. And it appears to be similar across cultures, geographical location, equal frequency in men and women. Studies have shown that hoarding begins relatively early at around 15 or 19 years of age, and early diagnosis, recognition, and treatment could have an impact to the favorable result of this mental health illness. So it's really important to be a supportive family member or friend to someone who may have observed to have hoarding disorder. So now, what are the causes and risk factors of hoarding disorders? So the cause is unknown. This is relatively new in the field of medicine, but there are 3 factors identified. Number 1 is family history. 50% with individuals diagnosed with hoarding disorder have family history of the same behavior. So 1 or 2 family members also have this hoarding struggle. So number 2 is history of obsessive compulsive disorder. So 1 out of 4 individuals living with hoarding disorder also has history of obsessive compulsive disorders in their lives. Number 3 is other mental health disorders. So hoarding can coexist with a broad range of mental disorders like schizophrenia, dementia, anxiety, depression, and substance use disorder. Stressful life events like death of someone or trauma could also exacerbate the symptoms of hoarding disorders. So it makes sense that if someone passed away in the family members, then the person who has this hoarding tendency will try to accumulate things for him or her to remember the loved ones who have passed away. Now, the treatment of hoarding disorder is number 1, cognitive behavioral therapy, which is of course done by mental health professionals, and 70 to 80% of those people with hoarding disorder respond to this treatment, and others also may benefit from medications like paroxetine. Also, it's important to have a strong support system from family members and friends who will help this individual rise up again and regain his or her control in his or her life, and the quality of life that he or she deserves. So I hope that you have learned something, and my purpose of this video is just really to educate someone. Again, do not use this to diagnose someone. It's just for educational purposes and awareness, and also to be empathetic and to stop passing judgment to these people who struggle with accumulating a lot of stuff. And also, may I encourage all of you to stop labeling someone as hoarders or as OC, like obsessive compulsive individual, because again, this mental health disorder is a real struggle, and that mental health professionals need to diagnose them to have such mental health illness, and we don't have to label individual just because they are trying to accumulate stuff. They have to follow those criteria that I have mentioned earlier. So thank you for watching. Until my next one, let's be kind, stop passing judgment to everyone, and understand a person from where he or she is coming from. Bye.